Good morning, everyone. So I wanted to welcome you to our very first panel. We have a great trio of speakers who are going to lead us through a discussion about how we can increase economic independence through employment and work. And this is going to be a combination of data that is both national and place-specific. And then we're also going to focus on a specific population as well. So I wanted to do some introductions. I'll introduce all three of our speakers first in order of their presentations. They will speak roughly for 20 minutes each, and then I will have a couple questions for them, and then you will have some opportunities to grill them on their great ideas. So without any further ado, let me introduce Carolyn Heinrich, who's the Patricia and Rhodes Hart Professor of Public Policy, Education, and Economics at Vanderbilt University, the co-director of Vanderbilt's International Education Policy and Management Program. Her research focuses on education, workforce development, social welfare policy, and program evaluation. Welcome, Carolyn. Bradley Hardy is a professor of public administration and policy at American University and a non-resident senior fellow in economic studies at the Brookings Institution. He also serves as a visiting scholar with the Center for Household Financial Stability at the Federal Reserve Bank of St. Louis, and his research interests include economic instability, intergenerational mobility, and poverty policy. Welcome, Bradley. And Manishi Deshpande is an assistant professor of economics at the University of Chicago and a faculty research fellow at the National Bureau of Economic Research. Her research areas include empirical public finance and labor economics with a focus on the effects of social insurance and public assistance programs and their interaction with labor markets. And with that, I'm going to let Carolyn take us off. Thank you.
Thank you, Camille, and thank you to the Institute for Research on Poverty and ASPE for having me come speak today. It's we have a great audience here, I know, who have lots of interesting experiences, and looking forward to the discussion we'll have. So I'm going to start out talking about workforce participation. One of the things that Steve Wagner just said in his opening remarks was talking about engaging folks on the economic sidelines. And so going back to the official end date of the recession, at that time the unemployment rate was 9.5%. The most recent unemployment rate in August 2018 was 3.9%. So that's a precipitous drop, right, on unemployment. Labor force participation rate in June 2009, when the unemployment rate was 9.5%, was 65.7%. In August 2018, it was lower at 62.7%. It's kind of contrary to what we think. We have, robust employment growth, and that's not bringing people into the labor market. We have recently seen wages start to uptick, but as you can see here, we seem to have plateaued out at that low rate. And so workforce participation rates this is a historic low. Also, interesting when you look at the numbers, these are also from August 2018. So you can see the total there, the population, and then the proportion not in the labor force. Just beneath that are the numbers of marginally attached and discouraged, the people who we think might wish to be in work, but they're not because they're not finding it. So that's actually a very small proportion of those not in the labor force. This is concerning in terms of this question that Steve Wagner talked about. How do we engage these folks who have taken themselves out of the labor market? So what underlies this weak labor force participation? How can we get more people into the workforce, actively looking for work and responding to those very low unemployment rates? So one of the things we know is we have issue of changing demographics. We have an aging population. So some of this, change is natural. So about the Federal Reserve Bank of Atlanta just did analysis of this, and They estimate that about a half of the decline in workforce participation since 2008 is related to demographic shifts, primarily the aging of the population. The long-term unemployed, a group that we also might think we might get back off the sidelines, our track record with that isn't so great. Only about 10% of them find a job in each month. Some of it, they lack up-to-date skills, and that's where training might play a role, give up or drop out. Another group that we're concerned about are prime age worker exits. So there's been a lot of attention to males whose labor force participation rate has clearly changed. So, currently there's this disparity, right, between males without a college degree and college educated. So college educated are participating rate about 90%. Those without a college degree, 78%. Whereas if we look back to 1950s, the labor force participation rates of these two groups were the same, okay? What has changed dramatically since that time is the differential in wages between these two groups. So roughly, it's almost a differential of 3 times the college educator, making about 3 times on average the wage of those without a college degree. So you would think that that might also be a motivation for people to want to get training to get back into work, right, to respond to those returns to employment. And then, of course, there's issues that we all are aware of, health and addiction. So we're going to have a discussion on this panel about concerns about disability. Addiction's been in the news a lot, rising rates of sickness, and then, of course, opioid dependency with that. Those are things that may also be keeping people out of the labor force, the people on the sidelines, and are not so easily addressed, but probably need to be addressed. Here's a graphic to go along with those numbers. So if we break down the labor force participation rate, the changes between the fourth quarter of 2007, we were entering the recession, to the fourth quarter of 2017, you can see that okay, so the change is the overall change is negative, right? We looked at that in that first graphic. The demographics is certainly contributing to part of that, but if you look at the behavioral cycle contributions, the retirees have actually, even despite their aging, they're helping, they're coming back into work a little bit. So they aren't really explaining this kind of where we've plateaued out here. And also the people with family responsibilities, that's less of an issue. The 2 bigger components, disability and illness, and then in school. So in school might be a good thing if people are actually getting degrees that would bring them back into labor force and help them earn more. But so that's the breakdown of the recent changes that we were just looking at. It shows we have some work to do to solve this problem of low engagement. So one more slide here I want to show you is a breakdown by participation rate by ethnicity and education level. So what you see here is that so the top 2 are Hispanics is the top line, the blue line, Hispanics with a degree. Hispanics with no degree is the green line just below that. And then non-Hispanics and non-Hispanic no degree are the 2 bottom lines. There's a pretty big difference there in the labor force participation rate. That might be something we need to study more. Some of the theories are these the people taking the jobs that are less attractive, they're not well-paying, long hours, working in industries like meat processing or things less attractive jobs. What's motivating them to participate in the workforce at much higher rates? This is something for food for thought. Okay, so let's talk about training. The market has actually presented some pretty strong incentives for people to get training, in the sense that the returns to skills are higher than ever, right? So having a college degree or some kind of degree like that versus not a degree substantially increases attractiveness of work. So that alone should be a big incentive for people to invest in improving their skills. So despite these increasing wage returns, we've actually seen participation rates in our two most recent publicly funded workforce development programs declining. So there's the Workforce Investment Act, which preceded the Workforce Innovations and Opportunity Act, very similar, both programs. Here, what I'm just showing is exiters, number of people who have participated and are leaving. And you can see a pretty dramatic change just from program year 2011 through the, across a relative 4-year period. That's a 30% decline in number of people exiting training programs. And also of concern is that they're not participating as long as in the past. This is just participation in all program services. There's different types of services. There's core services, which is kind of basic job matching, job search assistance. People can go there for labor market information. There's more intensive services that involve counseling and assessment. And then there's training. So across all the groups, you can see, so the 3 bars are, 4 weeks or less, 5 to 13 weeks, or basically 3 months maxing there, or 14 to 26 weeks, stopping at 6 months. So more people are participating for a shorter amount of time, which typically means you're less likely to be getting a degree, maybe a certificate or something if you are able to. And then the training specifically, this is also the case. So there are fewer people participating more than 6 months. This is actually continuing a long-term trend from the Job Training Partnership Act, which we had in the 1980s, 1990s, to WIA, where the training length and expenditures per trainee have declined significantly. So we're not spending as much, and people aren't spending as much time in training. So can they really skill up in that short of time when we're spending less time? So let's talk about what we're investing in and what we know from the studies, the research done by people in this room, and studies led by people in this room. So our U.S. public spending on our publicly funded training programs averages less than 0.5% of GDP, and most Western European countries spend 6 to 7 times more than that on their training. That's also the case. There is more, so employers have a role in training. Employers do train their employees, but it's the case that when employers offer training, they want to offer training specific to their firm's needs rather than general kind of portable training. It's actually the general portable training that has these overall returns to GDP for everybody. But employers have incentives to more narrowly focus the training on the skills they need, and they also tend to offer the training to the highest skilled. So the more skilled you are, the more likely your employers are to invest in you more, and also more competitive markets, right? So we worry a lot today about workers in rural areas and employment opportunities and the things that are keeping them from. They're less likely to be the ones getting the employer-provided training. So there does appear to be an important role for our publicly funded employment training programs to provide and training workers. The private sector does not have the incentives to do this. So, what do we know about what comes back to people who participate in training? So the majority of studies do find that vocational and on-the-job training are effective in increasing adult earnings. So I know there's a mantra, and I'll talk more about this at the end of my talk. People say that training doesn't work. That's an overgeneralization. When you look at the literature, and this is a summary of estimates, anybody who wants it, I have a paper with a compilation of the studies. So estimates from U.S. studies generally see earnings increasing about 320 to 887 per quarter, or that's about 5 to 26% of earnings, and employment increases as well. In fact, the work that we have done does show that those who are least attached to the labor market tend to benefit more from training. So that's important. It's also the case that the greatest returns come from combining classroom workforce training. So basically letting people get some on-the-job skills while they're learning the material. And this is contrary to job search assistance, which tends to have these shorter run impacts that fade over time. So basically, we also know that from some work Peter Muser and I did, that the payoffs to training are generally greater when jobs are available. So we have plentiful jobs. This might be a good time to getting more people into training. So what can we do about this? So here's some policy suggestions. So our current law, the Workforce Innovations Opportunity Act, has this nice provision, and that gives more flexibility than our past programs for people at the local level to shift funds around to serve different populations. Our dislocated worker programs have not shown to be as effective. We could shift more of those resources to other types of adults. And going back to the point made earlier about using data, and Jeff Smith is in the room here, and he and I have, I think, been saying this for decades now. We don't make good use of all these data we have. We have rich data in our workforce development systems, which could help us better identify which are the programs that are generating higher returns. We know that these averages mask a range of some programs that are more effective, some that are less effective, and it matters for who takes what types of training. We could get a lot better evidence on this if our data were more open. It's another conversation about how hard some of us have had to work to get access to this really rich data that states have. We also know that sectoral training programs that combine basic and occupational skills training in sectors with expanding labor market opportunities and engage employers in designing those programs tend to be more effective. One thing we could take a lesson from our UK counterparts, United Kingdom counterparts, is to use our one-stop centers to more actively play a role in coordinating these opportunities. One of the things I learned from in Tennessee, we have a Tennessee Labor Employment Activation Program. It was a grant program that was provided to create these kinds of opportunities. One of the things we found is that, for example, we're talking about reaching workers in rural areas. Employers need to have enough people available wanting to get trained to make these kinds of things work, right? They don't want to do this work collaboration, set it up and have 3 people show up for training. I was in Lubbock, Texas one time at a community college for another reason, but someone came up to me from the community college. It was very quiet that day, hardly anybody passing through, and they said, you know, we've got an employer and we've set up this program. The employer has jobs already. We've set up the training program and we're trying to get people to come in. We can't find people to come in. And he said, would you have a list of people? I was doing something for child support, so it wasn't related to that. But, you know, they're begging for people to come to their customized training program they designed with an employer waiting to offer jobs. So we need to, this needs to be, it can be effective when it's done well, but we need more effort in building those programs. I would also suggest that we start these earlier. Start them in partnership with secondary schools. So we do have some evidence that the dual apprenticeship type of programs that are combining school-based education with actual participation with firms is more effective. And, but we also need to recognize that if we're going to invest in these and do well, we may need to increase the funding for doing really high quality CT and apprenticeship programs. And again, we have a system now in the Workforce Innovations and Opportunities Act which requires coordination between education and labor. It requires that. This is a great opportunity to be forging those partnerships and trying to do this. We know that you know, outside of, you know, in Job Corps, the evidence has been quite mixed on it, but that most of our federally funded efforts have targeted youth for summer employment programs. We need to be thinking about engaging them, not just in summer employment, but in the context of their learning in high school. And just, you know, important point here, once youth are disconnected, there is no cheap and effective way to re-engage them, right? So we're talking about trying to re-engage a lot of adults who have stepped out of labor force and been out for a long time. It's much harder at that level. We could start here earlier with youth, and some of you may be aware of the Year Up program. So the Year Up program is a program out there that actually works to do this. You see the cost there, about $28,290 per participant, but they just had an experimental evaluation. The May 2018 findings the most, I think, encouraging findings we've seen in a long time. So average quarterly earnings for participants were $1,895 higher than the treatment group. Remember the average before I said was like from 300 to 800. And they had a 53% impact on their employment. So really big returns, but there's a price tag with that. Okay, so last slide, because I need to wrap up. Do we have the data elements we need to answer the question, does job training work? I'm going to say, is this the right question to ask? So one of the things you'll see, there are lots of headlines saying, oh, job training doesn't work, it's a charade. We're not getting anywhere with our worker retraining efforts. My idea is that it's the wrong question to ask, do they work? They can work. What does it take to make them work? Are we investing enough? Are we using the data we have to, within our system, to identify where we could be more effectively investing and for who? And so I'll leave it at that.
Advance with this one. Okay, great. Okay, good morning. And I think my comments are going to dovetail nicely with those of Manasseh's and Carolyn's as well. So, my goals here are to push a little bit on how we think we want to define economic independence, and maybe present some alternative statistics on how folks in the U.S. are doing, many of which mirror Carolyn's descriptive stats on the labor force, and then offer up some of my thoughts on where we might go. All right. If I can advance my slide. Hold on. That's okay. Maybe. Okay. Just looks like it froze up a little bit.
Yeah, it happened before.
Oh yeah, like that.
Okay, let's see if we can do it now. Oh, whoops, you're on panel.
Oh yeah, so we're the panel 1. Yeah, perfect. All right. Maybe we have it here.
Is it going?
All right, let's try it again. Okay, we built some suspense here. All right, so some definitions for economic independence. And, I think that obviously given the 4 TANF goals that Don was laying out, we could think about economic independence as just, the idea that we want to get people employed. And absolutely, my own view is that employment not only is going to raise economic well-being, but that there's dignity to work. And so this in and of itself could be defined properly as our goal, right? And we might push a little bit further to ask whether or not the goal is not just work, but work along some sort of upward economic trajectory, getting folks maybe out of poverty, maybe even out of near poverty. We know that $1 above the poverty line isn't necessarily much to cheer about. Even still, we might propose that our goal is ultimately to have folks not being dependent on or reliant on the safety net. And this is something I'll come back to later in my talk, right? But certainly as I pose this, I'm trying to push a little bit, and it absolutely depends on the individual circumstances people are coming to us with, and even the opportunities within the region. And so much of Carolyn's discussion was about, differences in how citizens are interfacing with their workforce systems, local opportunities, and you see a lot of regional variation. You see variation even within the same cities. And I'll show you what some of that looks like in some work that I have with co-authors. Even still, if you kind of flip it and take a look at yourselves, I would argue that you think about your own economic independence as the ability to have what it takes to withstand a short-term event, personal emergency, and you might even like to plan for something in the medium and long term. And so, I want to put that forward as another definition. Okay. So what do some of our indicators say about economic independence? And some of this is going to mirror what Carolyn was describing. And so what you're seeing here, kind of a noisy, economists love these noisy, figures and stuff, right? So, noisy figure, and I'd say that the unemployment rate is the hill you don't want to walk up, right? So this is going to be your blue and orange trend line, and I'm just showing you here overall U.S. unemployment rates and employment to population ratios, and here in other slides, I'm going to be doing a lot of black-white comparisons. That's a lot of my research. These results would generalize to rural, urban, and to more versus less educated. For the sake of time, that's kind of how I'm cutting the data. And I guess, it's just to say that we've made great progress with respect to economic health and well-being. But if you look at that flatter set of trends from 2000 onward, this really gets at the piece Carolyn started to mention, which is that, the overall participation here as employment to population is perhaps less than what we'd like, though it's still promising to see economically disadvantaged groups, including Black Americans, making improvements. Along those lines, I have the same unemployment rate overlaid with the labor force participation rate. Worth noting that while noisy, you can see some convergence in the Black labor participation rate to the overall U.S. average. But this is kind of a mixed bag, right? Because you've got the U.S. rate in blue sort of crawling downward, right? And then you got this very noisy trend with Black Americans moving upward. So, you're happy to see the upward trend for Black Americans, but this is also part and parcel to many other Americans, including some white males, doing worse. And so we have to be a bit circumspect about that. But now I want to introduce maybe some cuts of the data that aren't as widely shared. Some of this is because I'm using some data with some co-authors that maybe don't get discussed as much. There's an interesting data set called the Survey of Household Economic Decision Making. The U.S. Federal Reserve administers this data set. And here we're trying to understand what we think of as coping ability. And so to kind of walk you through this slide, we want to understand here across race, different types of families across the income distribution who are able to cope with the $400 emergency and who have at least $5,000 in the bank. So coping with the $400 emergency, something comes up, could you pay for it through your checking or savings? Or alternatively, could you put it on the check, or rather the credit card, and pay that off immediately thereafter? Now, we could debate about whether you like that definition, but the results are interesting here, right? So if you look, and I'm not sure how well this shows up in the cheaper seats, but essentially what's happening here is you have white respondents with over $100,000 who basically look very strong on the margin of being able to cope with the $400 emergency that's read out on this vertical axis. And the overwhelming majority also do have this sort of emergency buffer of wealth. Oftentimes we talk about wealth in terms of very conspicuous forms of well-being, but you can also think about wealth as just having kind of a baseline, level of emergency savings to cope with these expenses. And if you just go down the line, the triangular shape represents families between 40 and 100,000. We don't have a middle class definition in this country, but you can think about that as some version of the middle. And so these folks, as you would imagine, then, less ability to cope, but still almost 70% can cope with that $400 event. And, most, just inside of 80%, have that $5,000 in savings. And you go down the line. If we look at the black respondents in this survey, they don't do as well, but what's particularly important to note is that we're accounting for people who are broadly speaking in the same income categories, and it is a broad income band, so this isn't perfect data, right? But within this broad income band, one of the things you see is that blacks who could be broadly thought of or conceived as being in the middle, they are exhibiting the coping capabilities that look a lot like the lower income white Americans. And so this is troubling for whites and blacks alike who find themselves in this situation. But you're talking about blacks in this middle income band reporting that 40% could handle that $400 expense, and maybe just over 60% have this 5K in savings. And then certainly looking down at the lowest income group, across race, this is a difficult circumstance, and one that doesn't come out in some of the popular descriptive statistics about the economy. And I'm happy to talk more about this data offline. And so with that national statistic in mind, I want to kind of remind as we move forward throughout the day that economic independence and economic circumstances are going to vary greatly by place, rural, urban, across neighborhoods in the same cities, across counties in the same state. And so you're going to have a whole panel on economic mobility later on, but I'll just remind that, the very flexibility and autonomy that was discussed in the keynote is so crucial because we see these different economic circumstances. Our high poverty counties throughout America, and this is going to be denoted in the map where you get the heat map getting a bit more red, that's higher poverty. Well, those same places have lower upward mobility, and that's the lower upward mobility is going to be lighter in the adjoining map. And so they really do seem to have some association that if you're in that high poverty area, it's also an area where it's going to be harder to move up the economic ladder in terms of how your kids are going to do in relation to how you did as an adult. And so these are important topics for all of us in this room. Getting even more granular, I had the occasion to work on a research project with Marcus Casey, my co-author who's at Brookings and Illinois Chicago. We examined the trajectory of U.S. neighborhoods since 1970 on a whole range of economic criteria. And the motivation was to understand how black neighborhoods and then neighborhoods in general, as well as neighborhoods exposed to rioting, had evolved in the aftermath of the Kerner Commission on civil unrest. And so, interesting fact, we're at the 50th anniversary of the Kerner Commission. This was a presidentially commissioned group to examine the sources of rioting and civil unrest. That commission was landmark in that it not only called out racial discrimination as a key component to that civil unrest, but it also discussed explicitly job access, poverty, and neighborhood economic conditions. And so with that, we learned a lot in this work. That black neighborhoods, including those exposed to rioting, had improved overall on many margins, but substantial gaps remained. And here, you can check out the paper at Russell Sage, but here I'll just show you that poverty rates for these neighborhoods remain elevated relative to the national norm. So you can see that in the red and the yellow trends, these upper two trends. And then concurrent with this at the neighborhood level, these are not individual data. These are tract level statistics for the data walks. We see that public assistance use as measured in the decennial censuses drops pretty precipitously after 2000. Now, caveats apply here, including the fact that these are decadal statistics, right? So we're fitting these lines through. You've got recessions occurring in between. But we learn a lot about how these neighborhoods are evolving. And in fact, if we take a cut for poverty rate at the neighborhood level overall, I'm sort of telling you what many of you already know, but there's substantial differences between neighborhoods in the same cities. We focused on Washington, D.C., Newark, Detroit, and Los Angeles in that study. Okay, so the role of the programs that many of us know and care a lot about. And here I just want to briefly summarize that, look, we know from a lot of the evidence that participation in these programs is largely predicted by economic conditions as well as explicit efforts to expand access, that the programs provide an important buffer against economic volatility, earnings volatility, that it kind of smooths out those bumps. And we also know that food assistance programs have had a range of long-term benefits, including earnings, health outcomes, and the like. Earned income tax credits, many of which are supplemented by TANF state grants, including at the local level. They increase employment and income. I like to focus a bit on the DC case. I'm a professor at American University, and I've focused quite a bit on DC's supplement to the EITC, and we found dramatic reductions to inequality here at the local level. With that said, there are concerns in the research community, and this is more so a fact and a debate. I don't want to put it out as settled, but that some families might be getting by with relatively little liquidity. And so Kathy Eden and Luke Schaefer have done a lot of this work. And so I want to kind of close with a few graphics that depict some of these points. First off, very quickly, at the local level, we're just finding what a lot of you would imagine, which is that a large cash transfer has a substantial inequality reducing impact locally. So this is both the federal EITC along with the DC EITC, which is 40% of that federal credit. We see that the reductions look a bit larger in the eastern part of the city, where poverty is quite a bit more concentrated. So important program there. But I also want to pivot and, talk about how we have these local choices and how we see quite a bit of variation. We're in a room to talk about TANF, and, part of my motivation to think hard about coping is also to kind of dovetail to think hard about what our state programs are providing. And I think it's important to note that cash assistance is not the only thing that TANF can do. There's a lot of worthwhile programs that matter at the state level. But nonetheless, many states are spending relatively little on cash. And so I think this is something that we can at least reconsider or talk about as a group, hopefully, as we reconsider what TANF can be. I don't think that considering liquidity has to be in opposition to the goals for work readiness and work participation. I think those things can coincide. So just want to kind of close off by saying that I think geography matters quite a bit. Place matters. These interventions and problems vary by place. It matters and varies even within the same cities. And so a lot of this for me gets down to thinking about how individuals and families are coping, even if they're in work participation. And in that shed data where I showed you, these are individuals and families that report positive earnings. Many of these people and families appear to have some real gaps with respect to the ability to cope with the sorts of things that we can all imagine, car issues, home repairs, health shocks that are going to cost money. So very broadly, I want to recommend that here in DC, the EITC is working, and we might consider expansions of that, along with a SNAP program that's pretty strong and responsive to the business cycle. And as we think hard about where TANF can go, to kind of push on the notion that we can have a temporary program that is committed to providing some liquidity along with employment assistance. I'd also echo Carolyn's points about coordinating and continuing to coordinate TANF with WIOA. That coordination already occurs. I know in most, if not all offices, there is a TANF officer on site. But you know, that WIOA function, while it does have disadvantaged workers as a subcomponent, there's certainly more that can be done there. And I think this is really important because the sorts of jobs that we'd like to see people get into, moving up that economic ladder, in many instances, it might take longer-term skill commitments and upgrades. There might be creative ways to kind of marry the TANF program along with WIOA to do that even more effectively. And so, you know, just to close, I'm looking forward to learn as much as share throughout the day. But I think that as we consider our temporary program, we need to think about many of the groups that seem to have relatively permanent low wages and face some important barriers. How can we continue to sort of exhibit that flexibility within the definitions of our program? So look forward to the discussion, and thanks a lot.
Unless you think
All right. My name is Manasi Deshpande. I'm at the University of Chicago, and it's a pleasure to be here today to talk about some key questions in U.S. disability policy. And the reason that I titled this talk "Employment and Beyond" is that when I learned that the theme for today, or especially for this panel, is encouraging work, I asked, do I have to talk about that? And is it the only thing I'm allowed to talk about? And I was assured that it's not the only thing I'm allowed to talk about. And I think that's especially important in the context of disability programs. So, I mean, like all other programs, right, employment is one facet of the outcomes that we care about, but that's especially true with disability programs, where the reason that we have disability programs is that we think that there are some people for whom their medical condition is so severe that they should not have to work. And then another question becomes, how do we encourage work among those who can work? And then a third question becomes, how do we make that distinction between people who can and cannot work? So just a little bit of motivation for the talk. So as you might be aware, there have been substantial expansions of the Social Security disability insurance and supplemental security income programs in recent decades. More than 6% of the US working age adult population receives disability benefits. And some of the questions that I want to talk about today in thinking about, you know, is that a good thing? Is that a bad thing? How do we encourage work among disability recipients? Is first, what are the effects of disability programs on employment, right? So we actually have a substantial amount of work on that question. And then how do disability programs affect outcomes beyond employment? So, we know that there are effects on employment, but we also know that these programs, the reason we have them is that we think that they have benefits, that they increase consumption, they increase well-being, they increase health. There's much less literature on that, sort of that side of the equation. I'll present some work that I've been doing recently on that question. And then finally, how do the costs of applying for these programs affect who ends up applying? And what role does economic opportunity play in that decision? And when I say application costs, I'm going to use that term very broadly to mean any kind of burden that is associated with application. So that could be actually, filling out the forms and applying. It could be the amount of time that people have to spend out of the labor force in order to apply for disability benefits. Okay, so on that first question of how disability programs affect employment, so I just first want to start with what in theory do we think should happen when people get disability benefits. The first thing that we might think happens is that the amount of work that people do goes down simply because of the income transfer. So that's what we would call an income effect, and that's just people get money and so they work less. And in some sense, that's what we want disability programs to do for many people, right? That's the reason that we have disability programs is we think for some people they should not be working. They should be getting income instead of working. The second effect, moral hazard or incentive effect, is potentially more problematic. So this is the sort of the phenomenon in which people work less, not just because of the income transfer, but because basically they're told to work less, right? A disability in the United States is defined as an inability to work. And so disability benefits are conditioned on not working. If you receive disability benefits, you cannot work beyond a certain level of substantial gainful activity. And then the third phenomenon I'm going to talk about is what I call long-term dynamic effects. And this is the idea that these programs can have permanent effects perhaps through skill depreciation, through changes in preferences for work or labor force attachment. Those things could decrease work, but these long-term effects could also increase work if these programs promote health, if they promote well-being in other ways, if they help people, they provide work supports potentially or income to allow people to go to work. That's another way in which these programs could actually support employment in the long term. So what do we know empirically? Well, one thing that's difficult to do is disentangle these different channels. And these different channels matter a lot for public policy because, for example, if the reason that people aren't working is just that income transfer, then if we try to promote work by making the benefit phase out more generous, that's not going to be effective because the reason people weren't working was just the income transfer rather than that they were afraid of losing benefits. Right, so most empirical studies that we have are going to estimate income effects and these incentive effects together, and there's a general consensus that that disability programs reduce work moderately among adult recipients. So there's about 30 percentage point reduction in labor force participation, and again, those are combining both income and substitution effects, but they provide sort of a meaningful bound on that moral hazard effect. Now, what I want to talk about today is some of my research on the effects of these programs on children and young adults, and that's a question on which we have a lot less evidence. So the program in particular that I'll talk about is the SSI Childrens Program, which provides cash benefits and Medicaid to more than 1 million children with disabilities whose parents have low incomes and assets. And these kids, we know, have poor outcomes. They have dropout rates of around 1/2. They have arrest rates in adolescence of around 30%. And what I look at in this study is what is the effect of removing children with disabilities from the SSI program when they turn 18. So about 40% of SSI children, when they turn 18, will be removed from SSI, and that's based on the judgment that they can work as adults, that their disability does not prevent them from doing substantial gainful activity. And so in this study, I'm going to look at when we remove these kids from disability benefits, is that in fact true? Do they then go on to the labor market and succeed in the labor market? And the way that I'm going to do that is by using, if Don had his handy Pierre Wara book available. If you looked in that book, what you would find is a rule created by that legislation in which kids who had an 18th birthday after the date of welfare reform enactment, August 22nd, 1996, they got an age 18 medical review. Okay, but kids who had an 18th birthday just before the date of enactment did not get that review. And so the idea here is that these kids on either side of this cutoff are exactly the same, except that the kids on the right-hand side are going to get that medical review, and as a result, they're going to be much more likely to be taken off the program when they turn 18. So basically, this is the natural experiment. We're going to compare the kids on the right-hand side who get taken off to the kids on the left-hand side who stay on, and see, do the kids who get taken off, do they do much better in the labor market? So what I find is that they do a little bit better in the labor market, the kids on the right-hand side, than the kids who on the left-hand side who stayed on the program. Okay, so to sort of put the numbers in context here, this graph is showing you the earnings of the children in this age 18 cohort over time, so up until they're about 35 years old. And the gray line there is the kids who stay on SSI. Those are the kids on the left-hand side of that cutoff who did not get a medical review. They were grandfathered onto SSI. And the kids in the orange series are the kids who were removed from SSI because they got an age 18 review and they were deemed not to be disabled as adults. And what you can see is that they do earn a little bit more than the kids who stay on the program. But if we look at just the level of their earnings, it's about $4,000 a year in reported earnings. You can also see that there is no earnings growth over time. I think you'd be hard pressed to find another group in society with an earnings trajectory that is this flat. And I can also compare them to other disadvantaged kids. So the kids in the green series there are kids whose families received AFDC benefits when they were young, but the kids themselves are not disabled. So basically these are, the comparison group here is disadvantaged but not disabled kids. You can see that their earnings are also fairly low, but they have much more robust earnings growth over time, whereas these kids who are removed from SSI benefits have a very low and flat earnings trajectory. Okay, so what I find on net in this paper is that these kids earn a little bit more, so they lose about $8,000, that blue bar there, in SSI benefits. They gain a little bit of that back because they do earn in the labor market a little bit more. But when we add up all of that income, we find large income losses because the amount that they're working in the labor market is not nearly enough to replace the lost SSI income. So I think the takeaway from this paper is that taking away disability benefits alone is not enough, right? That it would have to come with some other kind of supports, some other interventions to really promote self-sufficiency in this child disability population. And then the next thing that I want to talk about is going beyond employment and thinking about how these programs affect other outcomes. So as I mentioned at the beginning, there's quite a bit of work on the labor supply effects of these programs, but not so much on the benefits of these programs. So in some recent work with co-authors, I look at what happens to disability recipients in terms of financial distress. How do these programs affect financial distress? Okay. And so what we're going to do basically is use another sort of one of these natural experiments and look at what happens to people, to disability applicants when they reach the 5th stage of the disability determination process. This is when the disability adjudicator will consider vocational factors. And basically what's going to happen is there are these age-based eligibility cutoffs where if you're just above 50 or you're just above 55, the Social Security guidelines are that the adjudicator uses more lenient standards to evaluate your application, and so you're more likely to get disability benefits. So this graph is just showing you that people on either side, on the right-hand side of both of those cutoffs, are more likely to be allowed onto disability. And so this is just a graph showing you that same thing, that they're more likely to be allowed, and then what we're going to show you now is a bunch of financial outcomes. So this is the probability that applicants experience foreclosure in the 3 years after they receive disability benefits. What you can see is that the applicants on the right-hand side of that cutoff are much less likely to experience foreclosure in the 3 years following their disability allowance. We also can look at the bankruptcy rates, and we also find a significant discontinuity with respect to bankruptcy rates in the 5 years after the disability decision. Okay, so both foreclosure and bankruptcy rates are falling. Applicants are more likely to purchase a home in the year following the disability decision if they are allowed onto the program. Okay, so home purchases are increasing. And so basically what we find is that what is the causal effect of these disability programs is to reduce the rates of these adverse financial events, especially foreclosure and bankruptcies, and it also increases the rates of home purchases. So it seems to be increasing the consumption of disability applicants, disability recipients rather. And then finally, the last thing I want to talk about is thinking about how application costs affect who applies for disability programs. So when I talk about application costs, I mean, in this context, I'm going to mean the process of going through the application process. It's a complicated process for disability, providing evidence of your medical condition and you know, having to follow up several times. And so what we find in this paper, and I'm not going to have a lot of time to talk about it, but I'm happy to talk about it more, is that higher application costs discourage applicants with moderately severe disabilities and low education levels. So essentially what we did in this paper is we looked at the closings of Social Security field offices. Okay, so this is, there have been about 120 field office closings in the last 15 years. And what we do is we look at areas surrounding these closed field offices and look at how the number of disability applications and the number of disability recipients changes when these field offices close. And what we find is large reductions in the number of applications. So the number of disability applications falls by 10%. We also find that the number of disability recipients falls substantially. So what does that mean? That means that it's not just people who are going to get rejected anyways, who are discouraged from applying for these programs as a result of the closings. It means that there are people who would have applied and received benefits, deemed eligible for disability benefits, who are discouraged from applying as a result of these field office closings. Okay. And I know that I'm running out of time, but I'll just show you one last graph, which is that these programs are discouraging people with moderately severe conditions, so not the most severe and not the least severe, but they are people who would have gotten disability benefits if they had applied. And sorry, I promise, last graph. The other thing I want to show you, since this is a talk about economic opportunity, is that it's really the lowest educated applicants who are the most discouraged from applying for disability benefits as a result of these closings. So it seems like college educated applicants are figuring out some other way to apply, some other way to get their application in even when the field office closes. Okay, now I officially have my 1-minute warning. And so I just want to wrap up by summarizing sort of what these questions. So thinking about what are the effects of these programs on employment, we know that they moderately discourage work, at least in the short term, among adults, and that these moral hazard effects appear to be pretty small for children, in part possibly because they're either because of their disability or their human capital. They are not they're not able to work at substantial gainful activity levels. We do need more evidence on the long-term dynamic effects of these programs. So that's something I think that's very important. It's a very difficult empirical question, but very important to understand how these programs are affecting recipients, not just when they receive the benefits, but permanently throughout their lifetime. And the second question I talked about is how disability programs affect outcomes beyond employment. So there's very little evidence on this question, how they affect things like consumption, well-being, health. I showed you some evidence that these programs reduce financial distress and increase consumption, and in particular home purchases. But there is a lot more work to be done on this question. And then finally, I talked about how application costs affect who applies for disability programs. Right? So it showed you that when it becomes harder to apply for a disability program because your neighborhood field office closes, there's a large decline in applications, and that's disproportionately affecting people with low education levels and fairly severe disabilities. And we also definitely need more evidence on how these program design features, like the amount of assistance people get with their application, the application process itself, how those things affect both how many people apply and who are the people who are applying and who are the people who are discouraged from applying as a result of these costs. So I will stop there. Thank you very much and look forward to the conversation.
So this was an incredibly rich panel with what I think are some very broad conclusions about the opportunities we have to really re-engage or engage people who are not currently participating in the labor force. And one of it's hard to escape the conclusion from all three excellent presentations that the current sort of social services system, particularly around providing employment and training, but also, as Monsi has noted, around how we work with people in the disability community. It's hard to escape the conclusion that these systems are not properly set up for people who are living their lives in conditions of a lot of stress. So the discussion that Bradley launched about liquidity and economic well-being, or lack of liquidity, lack of cash particularly. The observation that SSI offices are closed and that obviously has an impact on people who are most vulnerable, most disabled, and most likely to have lower education levels and their ability to participate in applying for the program. And the observation that training programs, in the absence of jobs in the area, don't succeed, makes one think that there are approaches that have been utilized for a very long time, but have somehow become misaligned with the populations that they're trying to serve. It's really hard to escape that conclusion. So one of the things I'm going to ask our panelists here is, given the fact that there is this kind of misalignment, or it appears to be a misalignment for the kinds of populations we're discussing here today, what do you think are the ways to retool some of these social service delivery systems so that they are properly aligned for an economy that's largely and most dynamic on the coasts, that increasingly depends on individuals in jobs who are making judgments based on dynamic information in contexts with a lot of dynamic information flows. That's really kind of the sort of employment picture. So how do you think we should be retooling some of these social service delivery programs so that they actually do align with the needs of individuals and the ways in which individuals need to plug in to the labor market now?
I want to pass.
So
I don't know if I have that right.
observation is that economists typically don't like to tell you how to design something. They're really great at telling you what the data says, but I'm going to push you guys.
Okay, so I've been nominated to go first. I think I'd like to point to something that we've learned from, I mentioned the Year Up program, which has had these dramatic results. And one thing that they have found in their they need to address a lot of things besides the actual skill development component. That's a very advanced component in that program. They work very collaborative with employers and to look for really good quality types of on-the-job placements. But there's a very important component that they've worked very hard to develop, and that is related to these other sets of skills about how to manage workplace and kind of some of the coping things that Bradley was talking about. So just to give a couple of quick examples. So one of their components of their training is basically no excuses. You have to show up on time. And so, you know, if it's a fact that you're, I'm sure some of you ride the metro here, right? Trains break down, they come late, they get stuck on tracks, you get late, and like, too bad. If you think it might take you 2 hours someday, and 45 minutes other days, you plan for 2 hours. And you show up. So part of that, and then also things about how to manage workplace culture. How do you deal with employees, coworkers who might say offensive things to you? How do you react and how do you respond? And, you know, so Sue Hausman and I, who's at the Upjohn Institute, we have a research project we've been looking at. We have employer data, which has very detailed data on why people are not hired into permanent jobs or do not get additional job assignments related to their performance on the job. And one of the things that we're seeing is a lot of this is soft skills, and a lot of it's related to things like attendance problems, right? So that has to be a component, but also has to recognize, I think, what Bradley's talking about, the ability to cope with these challenges, right, that you face in life. Your childcare breaks down. You have a sick dependent. Our workforce system itself doesn't have a lot of supports for families and those kinds of everyday contingencies. We have to help people, and they need, I think that's part of where other types of supports help people to work, right? But having those things, how do we do that cost effectively? We saw that Europe is not a cheap program to get people there. Also, just one last comment on this is my point about starting earlier. So I also work at an education project working with K-12 schools, or working with urban districts and some of the populations which most at risk of, for example, not completing high school. I was in some high schools last spring, not 2 weeks before the end of the school year, much earlier than that, and was going into some of those intervention classrooms, attendance rates about 25%. So if we're not teaching them how to attend their classes in school, where it's mandatory, they go to school, these same problems are going to play out in the workplace. I feel like that kind of early development of those combination skills needs to start earlier, before people get in the workforce and they're faced with these really difficult challenges, costly to ameliorate.
I'll preface this by saying I'm mostly going to evade Camille's question, but just a few observations on the interpretation of the the results on the outcomes of kids with disabilities. One is that this took place at a time in the late 1990s where the economy was booming, and the adage that all the rising tide lifts all boats. There were clearly some boats that got left behind, right? That if there was any time at which these kids could be expected to do well in the labor market, it was at that time, and they did not. The other thing I think that it's important to think about is how much of the low earnings and flat earnings trajectory is about disability, and how much of it is about poverty and low human capital resulting from poverty. So I showed you that graph comparing kids, SSI kids, to other disadvantaged kids, and so that graph strongly suggests that there is something in particular about SSI kids, that the SSI program may be very well targeted in the sense that it's enrolling the kids who are really at most at risk for poor life outcomes, and then we shouldn't be too surprised when they leave SSI and they have poor life outcomes. But I think that, right, both of those observations suggest that even if they are deemed in a medical sense to be capable of substantial gainful activity, they are not actually doing substantial gainful activity. and understanding why that is. Is it, is it a poor school system? Is it, other reasons for low human capital? Is, I think, just as important to think about and address as the disability angle. And then, another observation is when we were working on this, we compared kids with different types of disabilities. And so intellectual, physical, other mental and behavioral, which includes things like ADHD and speech delay. What we expected to find is that, and I think sort of the hypothesis, most people's hypothesis would be that the kids with mental and behavioral conditions, things like ADHD, would do better than the kids with physical disabilities and intellectual disabilities. And it turns out that that was not the case. That basically across the board, all of these kids are doing quite poorly in the labor market. And in fact, the kids with intellectual disabilities appear to be doing better than the kids with mental and behavioral conditions. One very speculative reason for that might be that kids with intellectual disabilities have other supports in the community when they leave SSI that kids with mental and behavioral conditions don't, because they are less recognized as disabilities. So just speaking to community supports, that's an interesting observation.
So I would just weigh in and say briefly that maybe formed as a set of questions. We have one-time payments that caseworkers are allowed to dole out to folks in the instance of an economic event, and I think we can just continue to examine, how those are doled out. What are the penalties or the circumstances that surround those choices? There's a lot of variation across the nation and how that occurs. And I guess I would just say that we've got some interesting local experiments occurring. You think about groups like, National Fund for Workforce Solutions. There's interesting community college employer collaboratives that in many of the urban areas are oversubscribed. And so this does call to mind some issues with transportation, density in areas that might be more rural. How do we confront that? But it's actually encouraging that in some of these sites, you have, pretty robust demand for jobs in, say, the healthcare sector with the local hospital system. The hospitals want it. A lot of people want these jobs, and jobs that are going to be moving them up the economic ladder. And so I think that we can continue to examine those cases, which, to my estimation, are largely funded through philanthropy, right? So are there opportunities to make investments there? And then just to continue to think about the resources that actual caseworkers have to do this work. You don't want to give people a knife in the middle of a gunfight, right? So how does that work? And how do we think about the task that we're putting on our actual caseworkers?
Great, thank you. We're going to open it up for questions. So do we have somebody with a mic? Oh, great, okay. Okay, so there's somebody over here, the white sweater.
Thank you. I was intrigued. Camille mentioned the idea of programs that are sort of working and functioning, but then the environments around them shift locally or nationally. And I wanted to raise the issue of a kind of big picture shift, which is that in the years since TANF was created, the big change that we've seen, it started before that, is the sort of complete absence of wage growth and the flattening or stagnation or decline in the wages that many program exiters face. And so it's striking to me that we almost never talk explicitly in discussions about TANF about what the wage opportunities are. And so I guess my question for the panel is, can you talk a little bit about whether or not you think it's feasible to think about a world of TANF where we still hold tight to this consensus that employment is key, but begin to focus a little bit on the short and longer term wage opportunities that people face, and if you have any ideas for doing that.
So could I add a part B to that, which is all these proposals and experiments
challenge this assumption that, we really just need to be focused on employment, but also focus on this element of wages. So I'd like you to comment on that, and the impact you think that might have on labor participation.
So first off, I would humbly say that Ann Huff Stevens basically made my point better than I could make it. So thank you. But no, I think that this is a real concern. And I think that this does not mean that there's not tangible, measurable benefits to employment participation. But, as I was kind of trying to pose at the outset, how do we define this economic independence? And we can be putting people to work at what are relatively flat wages. I mean, there's been some uptick in growth, but if you kind of restrict to some maybe less educated workers, you don't see that. And if you pull that apart, and I think, Carolyn, you might have had a trend that showed this at the outset. But this is certainly an issue. Again, I would probably just stop and say we have an opportunity to think about public policy at these inflection points where we're considering reauthorization. What worked, what didn't work, what might we reconsider, and we could still do that, and hold true to some of the broad goals of increasing employment participation amid the labor market realities, right?
So I'll give a kind of case example, for you. So I grew up in rural Wisconsin, and the big city near me was Fond du Lac, Wisconsin, which has like 20,000 people. But there's a big company there, Merck Marine. Some of you may have heard of Mercury Marine, makes outboard motors. So years ago, you could go into Merck Marine and start at wages in the 20s, right? And then at some point, they hit hard times. They were bought out, reorganized. And now if you go to Merck Marine, it doesn't matter. So I talked to someone who had previously worked for Merck Marine, making one of those higher wages. They went off to another occupation, worked for some time making veterans, but then had health issues, came back to this employer, and found out that despite the fact that they had experience and skills specifically for that employer, they had to start like everybody else at the bottom. So they started out working just above $10 an hour. So coming back in there, that was very interesting following with this person. A lot of the people who are coming to work in that don't want to stick with that. It's hard work. They don't see the returns to it. But if you do stay with it, so this person who continues working on does see pretty rapid increases in their wages. So, not getting up to where they were before, making 28, 29, but, quickly moving up to 17 and then 20 or whatever. So it's a different labor market. It's employers, and part of what I think employers are also seeing is these issues, like I was mentioning, with the soft skills attendance. Do people not see the value in working where, literally it is hard, even in rural Wisconsin where you can get some cheap rents in some places, it's hard to make it on $10, $12 an hour. That seems to be not an uncommon thing that is happening. And so that's also one of the reasons, like, for example, retraining workers. You may have someone, for example, laid off from the GM plant in Janesville, Wisconsin, go through training, someone who have very good wages, lots of work experience, hardworking. They train for an occupation, they got to start again at the bottom of the run with those wages per hour. It's hard to make it. And so this is a tough issue, and I don't necessarily have.
Scott, and I think that might be our last question. Go ahead.
Well, thank you for the opportunity. I'd be interested in hearing the panel talk about marginal tax rates, because it's one thing to get into a job and to think about the hourly earnings at that point, but to progress in the labor market, that's hard. That's hard work for workforce development program staff. It's hard for the worker and their families to kind of grab the next rung of the ladder. But there's often these kind of marginal tax rates or cliffs and notches in our benefit programs, which make that next dollar earned often not worth the full dollar in some ways that we saw in the disability presentation. I'd love to hear your thoughts on this and maybe some ways we can tackle that with policy.
No, that's a great question, Scott. And I mean, I think in part, I mean, we face this ultimate trade-off that ultimately, if we assuage that concern, and folks in this room think hard about this, you potentially increase the cost of these programs if you phase them out a bit slower, right? And I think that at the same time, this raises maybe larger questions about which parts of the family budget you really worry about in particular. So right now we have a housing program in America that's oversubscribed. It's not an entitlement, and in many of America's cities, this is the real bite. And so you've got folks who are coming in from the suburbs, a lot of your work on the suburbanization of poverty. This raises issues for folks who can't afford to work in the city center. And so I think that, for me, it does call to mind a reconsideration, particularly for some of those big parts of the household budget, like housing and health, and what we're providing maybe further up the economic spectrum.
Okay. Well, please join me in giving this panel a very, very warm thank you.